Doctors of Reddit, what's something you've had to tell a patient that you thought for sure was common knowledge? Had a lady measure her baby's temperature by preheating the oven and putting one hand in front of it while the other hand was on the baby's forehead. She told the nurse her baby's fever was about 250 degrees. Another vet here. Dead bodies decompose. If you leave your dead dog euthanized in the back of your car on the hottest day of the year, don't come crying to me when its belly fills with putrefying gases and bursts. Demanding I cover the costs of reupholstering your car might be considered a little rude as well. Podiatrist buddy told me this one. Lady has to have foot amputated and is given waiver forms to sign pre-op. Buddy asks if she needs time to think about it. She's very nonchalant and doesn't seem to care much what they do. He gets suspicious and probes a bit as to why she's not more concerned. She says she gets that they have to operate and it's okay because the foot will grow back. HD then has to explain she's not a salamander. Things get a bit more serious. Whoa, good thing he checked. I can see a lawsuit forming. He didn't tell me it wouldn't grow back. Mom brought her kids to the ER after they ate all of their Halloween candy because they had tummy aches. They were still eating Reese's peanut butter cups when they were in the exam room. I had to explain to her that they need to cut back on the candy and she looked at me like I had 3 heads. To reverse this, my mother brought me to the doctor on Halloween when I was 8. I had serious stomach pain. He said I probably had too much Halloween candy. 3 days later in the emergency room, yup, it was appendicitis. For almost a month, my friend had random pains. Bruises started showing up randomly. He looked ashen and what we first thought was him being lazy was actually him not having any energy. Finally his girlfriend got him to agree to go to the doctor, who sent him to the ER, where it took several doctors to figure out what was wrong, either because none of them had actually seen it in real life before, or they didn't think someone could be that stupid. Quote the doctor, "You have scurvy. Eat a freaking orange." My freshman year of college there was apparently a scurvy epidemic on campus, at least bad enough to make the campus daily, because some kids thought pizza and MTG was a sufficient diet. My wife and I were trying to get pregnant, and due to possible complications we were talking to obstetrician. Towards the end of the visit, he tells us, in all seriousness, "Just so you guys know, you have to stop using condoms if you want to get pregnant." We just stare at him a bit and say, "Obviously," and he just shakes his head and says you'd be surprised. There's been a few couples that really didn't realize that. You're still sexually active even if you are just on the bottom every time. How a shorter fatter 5ml oral syringe held more volume than a skinnier and longer 1ml oral syringe. How does this hold more liquid when it's shorter? Also I've seen almost every incorrect way to use an inhaler, upside down being fairly common. People taking birth control pills only on the days they have sex. I no longer assume anything is common knowledge. I'd rather someone be offended that I explained something basic than to have something awful happen because I assumed the patient knew something. No joke, a panicked 29-year-old came to the office for corn in his stool. He genuinely thought something was wrong. That a PhD isn't that kind of doctor. Please don't show me that rash. Part of me wants to get a doctorate just for that. A nursing home called 911 for a patient who was having difficulty breathing. When we arrived, a PA was standing in front of the patient vigorously fanning the old lady with her hands. She looked at us and said, "I'm giving her some oxygen because we couldn't find a portable O2 tank," and keeps flapping her arms. Remember, this is a physician assistant, probably making 100k a year. I informed her that she could stop now and my partner and I did our best to wait until we were outside to burst out laughing. Pediatric nurse here. I've told more than one parent that their infant should not be drinking Dr. Pepper out of their bottle, or any other vessel for that matter. I had a patient come in for an STD check. She was very upset and continued to tell me that she only had one partner. Progressing through my assessment she further divulged that even if he was sleeping with other people it shouldn't matter because he uses a condom every time and he makes sure to wash it thoroughly after every use. I asked what she meant when she said he washes it after every use. She explained that he washed the condom with hot water and soap before he used said condom again. I had to explain to her that condoms are a one-time use product. She had no clue. Out of everything I've read so far, it's always the stuff that comes back to horrible sex ed that terrifies me the most, and this is probably one of the worst. Viagra does not prevent STDs or pregnancy. I once had to use the word dong instead of penis because the patient did not know the proper term for his genitalia. That's worse than the nurse who continually referred to my son's penis as his PP. If you're going to put it in your ass, make sure it has a flared base, or is attached to something you won't lose your grip on. Corollary, if you've already lost something in your ass, don't lie to the trig nurse and then medical team. While your story is usually amusing, we don't really care how it ended up in there. I've heard of this before. My question is, why can't you just push like you do when taking a poop? Not a doctor, but a nutritionist. I work with a lot of different patients, and I have tons of stories about food stupidity. Had a lady have bariatric surgery. Your stomach gets surgically stapled smaller, and her mother kept trying to force her to eat real food the day of the surgery. When she was on a liquid diet, she would eat it, puke, rip her stitches out, repeat. We had to ban the mother from seeing her, because she would literally blackmail and guilt trip this poor lady into eating a whole pizza. Buff it all up because her poor post-surgery stomach couldn't handle it and end up ripping out stitches and causing enormous pain, because her mother was positive that she would die if she was on a liquid diet for a couple days. Another lady I was seeing for clinicals was diabetic, and she would come in every week with stupid high blood sugar levels, 250 560ish, not knowing why they were so high. She kept a record of everything she ate, and all her food intake seemed fine. One day, her husband came with her, which was weird, and he ninja slipped me a note while shaking my hand. It read, "Ask her about the quick trip slushies." She doesn't believe me that they have sugar in them, so I asked her if she was having any soda, lemonade, tea, ice cream, shakes or slushies, and she told me, like a light bulb had gone off in her head. Well, I have been drinking about 3 of the 48-ounce quick trip slushies every day for a while now. They're just so good. And they aren't food or drink, they're slushies, so they don't have any sugar in them, and I don't need to record them. It was so hard to convince her that those are so full of sugar it isn't even funny. But seriously, 3 a day on a type 2 diabetic. It was one of the stupidest things I have ever heard in my life. Good on the husband that he cares enough to try to explain, and when his words fail, having you do it without embarrassing her. Have had to inform a few male patients that the condom only goes on the shaft and should not be pulled down to include covering of the testicles. Just the mental image made me crack up. Be right back, got to try something. For God's sakes, don't put butter on a burn. Had to explain to a 27-year-old female that this bleeding she was having for a week every month was normal and why. She had 2 children, BTW. My mother is a nurse, and has been for over 25 years. The only story of hers that makes me sick is the story of a man who could not afford Viagra, so he reasoned his cork gun should do the trick, right? It'd stay in there and keep him hard. So he put the tip of the gun in his urethra and filled himself up. Long story short, don't do that. Don't, for Christ's freaking sake, ever do anything even remotely like that. He put cork in his dong. I can see his logic behind that. I had an old lady come in with a massive bleed in her brain. She was pretty much gone. I had to explain to her tearful son that there was nothing we could do. He said that he loved his mama, and he'd give anything for her. So he asked us to give her his brain, for a brain transplant. I actually was left speechless for a minute, and then had to spend another 20 minutes explaining why that was not possible. Now that just breaks my heart. No, those aren't tumors on your dog, cat. Those are nipples. Yes, males have nipples too. My dad is a family doctor in the States. A woman came in for a well baby check with her 6-month-old and she had what looked like chocolate milk in the baby's bottle. So he started explaining to her as kindly as he could that she shouldn't be giving her baby chocolate milk, at which point she interrupts him and says, "Oh, that isn't chocolate milk. It's coffee. He just loves it." I'm an RN in the ICU. I've seen some really stupid people over the years. But a few weeks ago a patient's family member got into a verbal altercation with me over the fact that I was trying to freeze his mother to death. He kept pointing to the digital thermostat displaying a temperature of 23 degrees Celsius. We're in the US. BTW. When I gently explained to him that 23C is not at all cold, he just kept pointing to the display and shouting, "You don't think 23 degrees is cold? It's 23 freaking degrees in here," and acting insane. After multiple attempts to explain to him what Celsius is by myself, the charge nurse, house supervisor, and security, we finally gave up and had him escorted out. He was a man in at least his late 30s who graduated high school and had never heard of Celsius and Fahrenheit. He literally thought we were making it up in an attempt to conceal my efforts to freeze his intubated, critically ill mother to death. For some reason, out of all of this, the one part I'm especially stuck on is that he could stand in a 70-odd degree room and believe it to be 23F, just because he saw that number on a wall. Somehow he knows 23 degrees would be enough to freeze his mother, but doesn't seem to take note of the fact that the air around him is not, in fact, freezing. FFS, even his skin is stupid. A hospital is open 24 hours a day 7 days a week for medical emergencies. So, the next time you have a stroke on a Friday, come in on Friday and don't wait for the weekend to pass. That a child cannot have inherited any genetic traits from someone the mother has previously been with. Only one man is the biological father. In a sociology class we read about a tribe of people in either Africa or a Pacific island who believed that you had to have sex with multiple men in order to make a baby. Like a uterus required X amount of baby juice to make a baby, and if it all came from one dude then the kid would be messed up somehow. On the upside, that meant that all of the men worked together to be a father to the kid. Oh, I've got another one. Inhaler technique. So we're told to always show a patient how to take an inhaler if they are new to them, and that we should check technique every so often. Yeah, you think, how hard can it be? Well, my senior once noticed that a patient was getting repeat prescriptions for an inhaler every week rather than every month. We brought her in to find out why. Oh, it just doesn't seem to work very well. I press it up to 50 times and it doesn't help. We were in shock over this. Salbutamol inhalers taken in excess, we're talking like 10 puffs taken in an asthma attack, can give you a thumping headache, a tremor and a dry mouth. How is she taking 50 and not noticing? We asked to see the technique. Yeah, turns out she was spraying it onto her chest. Internal fascipams were had and we educated her on how to take it properly. My grandmother was the ignorant one getting and explaining. She was 18 and in labor with her first child. She was the kind of lady to wear pants in the late 40s. The nurse looked her up and down and told her to put on the labor clothes. So she took off her top and bra and got on the bed. The nurse is really confused. Take off your pants too. Why? It comes out my belly button, right? Asked grandma. No darling, it comes out the way he came in. That just because it says contains vegetable extracts on the side of it, a can of Coke does not count as one of your 5 a day. During paramedic school my teacher was a PA who told us a story of a lady that came into the clinic he was working at. She said she didn't feel well, nothing but general fatigue and not feeling right. He had the nurse do a standard set of vitals and a blood glucose. Her glucose was extremely high, so he goes in to talk to her. He asked, has anyone ever told you that you have diabetes? She replied, yeah, a doctor said I had that once and I took some medication for a couple weeks and felt better. He then had to explain to her that diabetes doesn't go away after some medication. After putting a few stitches in a middle-aged guy's scalp, the family asked if he was okay. The attending joked that his brain was still inside. The family was stunned by this news. I, the medical student, spent the next half hour informing the family that the brain was inside the skull and that a person couldn't live without one. They thought that the brain was just a turn-off phrase to reflect a person's common sense rather than an actual organ. Sort of the same as what they thought about the heart. I had the opposite happen to my wife. She was pregnant and had a thyroid nodule. We were concerned about how removal could affect the pregnancy due to changes in hormone levels and anesthetic during the surgery. We stated this concern quite clearly and in great detail. His response was that he would be operating on the neck and that it was nowhere near the baby. Thanks for answering a question we never had and ignoring ours. He was really pushing for surgery before delivery. We did not see him again. I hate when doctors do this. No, I am not asking the standard patient question. Listen to the question, not what you assume the question to be. Pharmacist here. I have a couple of good ones off of the top of my head. The first one. Patient comes in, she's upset, she's pregnant, and she doesn't understand why she's on the pill. Upon talking to her at great length, I find out that she only takes the pills on the days that she is sexually active, no other time. The other story is a related one. Same scenario except patient comes in with her BF. They are indignant, as if somehow I could have prevented it. The problem this time? Well, the pills were bothering the girl's stomach. So, being a gallant BF, he decided to start taking them instead. These are all true. Sometimes the things you see in pharmacy make you fearful for the future of the human race, and I'm not exaggerating. These stories are just the tip of the iceberg. You've been stopped by the bread cat. Like this video too or he'll eat all your bread. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.